Hi everyone, we are covering hospital management COQP22 for CUETPG 2025 and we are covering the syllabus for quick revision. So we are currently on this topic. If you want to watch the previous video, you can watch on our channel. So let's get started. Start with medicine and social science, understanding the concept in sociology of health. So we'll start with the topic. All right. So medicine and social science. Social science or sociology of health is what? Sociology of health examines how social structure, culture, norms, and human interaction influence health, illness, and healthcare systems. Right. So, every social structure, kind of, let's say, uh, culture norms, culture practice, religions, and human interaction, right? Different people, different society, different culture has their different way of understanding diseases and treating the diseases. Apart from their, our general way of treating. So they have their own way of understanding diseases, calling diseases, and treating the diseases. Right from ancient time it was. So in some way, health is affected, or we can say it mean to say kind of influence, right, on health, right, by those practices or sociology of health we call it. So let's understand key concept in health sociology. There are three key concepts we are here today with, are like health as a social construct, right? So as we know, like different cultures define health and illness differently, and social determinants of health we have. Those include economic status, education, employment. This determines health, how health will be. Social support, access to healthcare also determines how your health will be. Environmental factors like sanitation, pollutions, these also affect how your health will be. So these are social determinants of health, social factors of uh, social factors which are affecting the health. Then again, health inequality are there, like disparity due to income, caste, gender, and geography. So it's also depend like if someone is not uh, that much, financially stable, so they can't afford some healthcare services, right? Due to disparity in due to income and all, right? So okay, next again we have sociological perspective on health. There are three kind of perspective we have. One is functionalist perspective. It includes health is necessary for functioning society. Illness disrupts social order. Right. So functioning of society, and for that, health is very important. Right. We have conflict perspective. Next is healthcare resources are unequally distributed, benefiting the wealthy. So it's again we have already discussed. So who is wealthy, they can access some premium healthcare services, right? Then we have symbolic interactionism, personal experiences and the culture belief shape perceptions of illness and treatment. Right, as we already discussed, cultural belief people have, right? So those practices may affect treatment and all in some way. Then we have psychology and health. So psychology is the health explorer, explores how mental processes, emotions, and behaviors affect physical well-being, right? So again, psychology again explore this part. Uh, Psychological factors affecting health, stress and health, personality and health, behavior, and lifestyle choice. Stress and health, like chronic stress lead to heart disease, diabetes, mental disorders. Personality and health, that's the type of personality, like more prone to hypertension and heart diseases. Optimistic versus pessimistic attitude impact recovery from illness, right? behavior and lifestyle choice, smoking, alcohol, diet, exercise, directly affect health. Then we have psychological approaches to health. CBT, cognitive behavioral therapy, used in treating anxiety, depression, and chronic pain. Next is health behavior models, include HBM, health belief model, and TTM, trans theoretical model. HBM behavior depends on perceived risk and benefits, right? So, risk and benefits decides the behavior, right, of taking treatment, right, or regarding the health. Next, TTM. In TTM, stages of changes in adopting healthy behavior. So, different stages, like when we are adopting some healthy behavior, there are different stages: lifestyle change, health change, right? So, those are called in health behavior model, TTM, trans theoretical model. Next, we have social psychology and health. Social psychology studies how individual behavior and attitudes are influenced by society and groups. Influence of society on health behavior. Social norms, peer pressure, and social support are some elements in that, like social norms like smoking bans, healthy eating campaign, and fitness trends influence choice. All these things affect health. Peer pressure can also lead to both positive and negative way. Can be exercise, vaccination, or drug use, maybe. So next we have social support. So family support and relative and community support may maybe improve health and mental health and physical health both. Attitude and behavior change in health. Persuasion and health communication. Role of stigma in disease. So public health campaign use media to promote behavior like hand washing and vaccination. Stigma associated with mental health like HIV, AIDS, and disabilities affects treatment seeking behavior. Family in health and disease. The family plays a crucial role in shaping health behaviors, providing emotional support, and managing illness. The role of family in health. They support in health education. They support uh, during week time, right? Like someone is weak or not healthy, they support in them. Caregiving also is there, right? Then family and disease, we have genetic factors affect uh, affect some family, like uh, disease passed from parents to their children, right? Like disease like diabetes, hypertension, cancer. These diseases can be inherited, right? Psycho social impact. Illness in family members can cause stress, financial strain, and lifestyle changes. Domestic violence and mental health. Abuse and neglect impact physical, psychological well-being. So this topic was very short and concise. Just we have covered what are the social impact, social influence on someone's health. You can cover one more time from the ebook given in the description. Let's move to the next topic. Next, we have cultural factors in health and disease. So earlier we discussed about social factors. Now we have cultural factors. So culture is significantly influencing health in some way. Health behavior, perceptions of health, illness, and healthcare seeking patterns will be influenced by culture. Uh, Role of culture in belief in health is like belief and traditions. Some culture rely on traditional medicines, Ayurveda, Unani, homeopathy over modern treatments. Dietary habits like food choice based on cultural belief impact nutrition and disease prevalence. For example, vegetarian diet and high meat diet may cause different influence on health. Religious practices, fasting, prayer, restriction on medical interventions may affect health. For example, Jehovah Witnesses and blood transfusions, right? Next, we have cultural barriers in healthcare. So, cultural barriers like stigma and taboos, mental illness, HIV/AIDS, and reproductive health issues may be ignored due to stigma. So, that can be difficult to manage that case. Language barrier, difficulty in communicating with healthcare providers, affecting treatment outcomes. Traditional versus modern medical medicine conflict. Some patients prefer herbal remedies over clinical treatment, right? Next, we have hospital sociology. Hospital sociology studies the social dynamics within hospitals, focusing on doctor-patient interaction, hospital administration, and healthcare accessibilities. Structure and role of hospitals. Primary role, treatment of illness, preventive healthcare, medical education, and research. Types of hospital, we have public, private, specialized hospital, teaching hospital, institutes, and hospital as a social institution. Hospitals reflect social hierarchy, doctor-patient, nurse-doctor relationships. Doctor-patient relationships. Uh, Paternalistic model. Doctor makes decisions without much patient input. Shared decision-making model. Patients participate in treatment choice. Impact of social class. Wealthier patients may receive better care due to financial status. So that is again doctor-patient relationship affecting health. Then challenges in hospital management. Overcrowding, healthcare inequalities, workspace stress. So these are some challenges that may appear in hospital management, right? Uh, Social problems and health. Various social issues contribute to poor health outcomes and healthcare disparities. Major social problem affecting health are poverty, malnutrition, substance abuse, violence and crime, environmental degradation. Poverty and malnutrition leads to higher rates of infectious disease, anemia, and developmental delays. Substance abuse include alcohol and drug addiction contributes to liver disease, mental illness, and social instabilities. Domestic abuse and gang violence increase physical and psychological trauma. Pollution and poor sanitation lead to respiratory diseases, waterborne diseases, infection, and cancer. Impact of social problem on healthcare. Increased disease burden, higher incidence of preventable diseases, healthcare cost. Again, healthcare cost is again very, we can say, important factor that one should care, uh, right? And like it affects mainly people with inequalities, disparity in income, treatment of substances, abuse, injuries, chronic disease, increased public health expenditure, reduced productivity, poor health, induced workflow efficiency, affecting economic growth. Basic health economics. Health economics deals with the allocation of resources to healthcare and its impact on population well-being. Key concepts in health economics. Demand and supply of health services, healthcare financing, cost-effective healthcare, and yeah, that's it. So we have first is demand and supply of healthcare services. High demand but limited healthcare facilities lead to increased cost, right? It's straightforward thing. Shortage of medical professional affect service delivery. Healthcare financing in that include government funding, private insurance and out-of-pocket expenses, international funding like WHO, World Bank, they fund some healthcare institution. Then we have cost effectiveness in healthcare. So how we can achieve that? Prioritizing preventive care like vaccination, sanitation, or expensive treatments. Investment in primary healthcare reduce long-term cost. So they should do that. Economic changes in healthcare. High cost of medical services, advanced treatment are unaffordable for many. Pharmaceutical pricing, essential drugs may be expensive due to patents and market control. Medical insurance gaps, not all populations are covered, leading to out-of-pocket expenses. Next, we have social security and population health. Social security measures provide financial and medical assistance to individuals, ensuring public health protection. Importance of social security in healthcare. Public scheme like Ayushman Bharat and Medicare help lower medical costs. They provide health insurance program. Unemployment benefits help maintain healthcare access during job loss. Pension schemes ensure elderly access to healthcare services. Social security and health outcomes. Reduces health disparity, encourage preventive healthcare and financial stability for families. So we covered the topic. Next, we will start hospital management in the next video. Thank you so much for watching. Good luck for your exam.